Diverticulitis. The best treatment options. Diverticulitis is a painful and upsetting disturbance in the digestive tract, a colon disease, which can be effectively treated with the diverticulitis diet. While some individuals experience constant discomfort, others experience diverticulitis that wanes, and then flares up. Diet and a variety of risk factors can increase your chances of suffering from diverticulitis, especially after the age of 40. Diverticulitis is the infection of the small sacs of diverticula that line the digestive tract. Diverticula seldom cause problems, or severe discomfort, unless they become inflamed or infected, in which case, the diagnosis is diverticulitis. It is believed that 10% of Americans, over the age of 40, is affected by diverticular disease. The rate continues to increase through aging. In cases of a serious infection, antibiotics may be needed, in addition to a change in diet. Many people find relief by limiting flare-up foods, and focusing on foods that are easily digested. Think of diverticula as storage sacs of plaque, much like what can clog arteries, except they reside typically in the lower part of the large intestine. As with clogged arteries, it is important to first clear the area, and then continue with a healthy diet. Diverticula sacs can become blocked with fecal matter, allowing bacteria to build, resulting in an infection. As the sacs grow, they put an increasing amount of pressure on the walls of the intestine, leading to pain, gas, abdominal discomfort, and other diverticulitis symptoms. This pressure is increased during bowel movements. Be mindful that constipation is both a symptom and a contributing factor to worsening symptoms. Left untreated, infection and perforation may lead to scarring in the digestive tract, where scar tissue may cause a partial or complete blockage. This is why it is essential to make the necessary changes to help heal your digestive tract. Diverticulitis symptoms. In the early stages, mild diverticulitis symptoms can be treated with rest and the diverticulitis diet. Severe or recurring diverticulitis may eventually require surgery for relief. That is why it is essential to watch for warning signs, and start making dietary and lifestyle changes as soon as possible. If you are experiencing 2 or more of the following symptoms, you may have diverticulitis. Marked change in bowel habits. Severe abdominal pain. Cramping. Tenderness in the lower abdomen. Nausea. Alternating diarrhea and constipation. Fever and/or chills. Causes of diverticulitis. Today's typical Western diet often consists of highly processed foods, sugar, and unhealthy fats. This type of diet contributes to the development of diverticula and an infection. Eating a diet rich with fiber can help to prevent diverticulitis, and helps in the healing of the colon. In addition to a poor diet, there are other risk factors to consider. Aging. Obesity. Smoking. Prescription medications including opiates, steroids, and non-steroidal anti-inflammatories. Lack of regular aerobic exercise. All of these risk factors, combined with a diet lacking in necessary fiber, and high in animal fats, can lead to the development of marble-sized diverticula in the digestive tract. The resulting inflammation, infection, and leakage into the abdominal cavity is uncomfortable at best, and has the potential to cause serious complications. Diverticulitis, treatment. Initial treatment. Treatment for diverticulitis depends on how bad your symptoms are. If the pain is mild, you are able to drink liquids, and you have no signs of complications, treatment may include medicines such as antibiotics and pain relievers. Changes in diet, starting with a clear liquid or bland diet that is low in fiber until the pain goes away, then increasing the amount of fiber. If the pain is severe, you are not able to drink liquids, or you have complications of diverticulitis, a hospital stay is needed. Ongoing treatment. Treatment after recovery from an attack of diverticulitis is aimed at preventing another attack. Treatment may include gradually increasing the amount of fiber in the diet through fruits, vegetables, wheat bran, and possibly the regular use of a fiber supplement. Getting plenty of fluids daily. Having regular doctor visits to monitor your condition. If you have more severe diverticulitis, you may need to go to hospital, particularly if your pain cannot be controlled using paracetamol. You are unable to drink enough fluids to keep yourself hydrated. You are unable to take antibiotics by mouth. Your general state of health is poor. You have a weakened immune system. Your GP suspects complications. Your symptoms fail to improve after 2 days of treatment at home. Surgery. If you have a history of serious complications arising from diverticulitis. If you have symptoms of diverticular disease from a young age. If you have a weakened immune system or are more vulnerable to infections. Colectomy. An open colectomy, where the surgeon makes a large incision, cut, in your abdomen, stomach, and removes a section of your large intestine. Laparoscopic colectomy, a type of keyhole surgery where the surgeon makes a number of small incisions in your abdomen and uses special instruments guided by a camera to remove a section of large intestine. Diagnosis of diverticular disease. Since diverticulosis is often asymptomatic, without symptoms, it tends to be discovered during examinations for other conditions such as colorectal cancer. Diverticulitis is usually diagnosed during an acute attack. Tests to confirm the diagnosis of diverticular disease include medical history, including dietary habits, physical examination, including rectal examination, colonoscopy, a slender flexible tube inserted into the anus so that the doctor can look at the entire length of the large intestine, barium enema, a special contrasting dye flushed into the bowel via the anus and X-rays are taken. CT scan, to detect abscesses outside the bowel lining. Blood tests, to check for signs of infection. Stool tests, to check for the presence of blood in the feces or the presence of infections, which may mimic the symptoms of diverticulosis and diverticulitis.